Good morning, innovators. David Wright here, and I am your host of the Disruptive Innovators Champions of Digital Business podcast. And today I am lucky enough to be joined by none other than Sandra Elliott. Sandra, it's a pleasure to have you on.
It's a pleasure to be here.
Yeah, I know it's been you're saying almost a half year in the making, so it's amazing to have you. Sandra, for those of our listeners who may not be familiar, could you just share a little bit about your current role?
Sure. I am the Chief Innovation and Commercialization Officer for Hackensack Meridian Health, which is the largest health delivery system in the state of New Jersey. We have 18 hospitals, large home care agency. I mean, you name it, as far as an element of a care continuum, we have it. So it creates a very unique opportunity to identify innovative solutions and problems that need solving. So I'm super excited about. I always tell people I have one of the best jobs in the world. So I get to have a lot of fun with really smart people and solve problems that face everybody every day.
Yeah, absolutely. And as a New Jersey native, very familiar with Hackensack, right? Where before it was Hackensack Meridian, Shafiq Rob was the CIO there years ago, friend of mine. David Flood was at Meridian, which then merged with Hackensack. So yeah, it's been amazing to watch the kind of development of the system over the years. And yeah, it sounds like a really fun position. So I'm excited to talk more about that. Before anything though, Sandra, we like to start the episode with a piece of actionable advice you might look to leave everybody with today.
I think one of the things that immediately comes to mind is never assume you know the cause of a problem. Always dive into a problem. Always assume that there's another layer to the onion of a problem, because the more you dive into the problem, the easier it will become to actually create solutions that target an outcome that you're looking to achieve or to solve that problem.
I love that advice. I think for me too, 'cause that definitely resonates with me. It speaks to a degree of humility that I've had to develop over the years too, of being comfortable in the not knowing, right? Because you think, as a young executive, I need to know the answer, right? But it's just not true,
Exactly. I think that's one of the things that, we call it our healthcare exercises, our ability to exercise is that we jump to conclusions, right? We try and get to the heart of the solution. And it is very difficult to, humility is the right term, to be humble enough to step back and assume that you don't know more than you know, right? And really engage people in a way that really drives to a better understanding of a challenge or a problem. And that's not an easy thing, because we're a society that likes to move fast, and sometimes taking a pause is not necessarily the most natural thing that we want to do.
Yeah, no, 100%. And it's a great topic. I mean, we've also seen that healthcare kind of grew up, and for whatever reason, and this isn't just healthcare, right? But we saw that different aspects of the health system and different operational groups kind of had different silos, such that oftentimes when there were issues, they would float up one silo and then back down one silo and then up another silo and then back down a silo. And, it caused a lot of time to go by and inefficiency. And how are we trying to kind of flatten that out? And also we learned, I'm thinking of an academic health system we worked with on an imaging latency issue, which you might think, well, that's a technical issue, right? But it was actually death by 1,000 cuts, right? It was quite a few different technical issues, but also a lot of kind of layer 3 kind of operational, cultural issues, right? So if I would have just presumed that it was the the security setting here, right, I would have not opened my eyes to the myriad of other things that were going on.
Right. And there are usually a myriad of other things going on. Yeah, and it's interesting as you talk about the silos. I think one of the things that, and I hate to bring up COVID because everybody does, but I think one of the things that was really unique about COVID is it really focused everybody on kind of one common challenge, which was getting through it. And I say that in kind of a high level, which meant that everybody had to be focused in on diagnosing, keeping people safe, getting them through that journey until we could clinical journey, even just before we actually had any treatments available or the opportunity to get people vaccinated. But it really forced people to connect on one key problem. And I think in many respects, that actually helped break down some of those silos because it forced people to understand what we all bring to the table. So I think it's been the hard part is really keeping that flatness, that opportunity, because it's much easier when the challenge goes away or the crisis goes away to kind of feel much more comfortable and going back to what was more comfortable. But I think one of the things that you mentioned earlier about being comfortable with being uncomfortable is a really where we grow both culturally, organizationally, from a career perspective. It is a very difficult thing to do, but it is that skill set of being uncomfortable and sitting in it and feeling like you're going to come out of it that really helps you evolve either from a role perspective, but also even as a culture of an organization.
Yeah. I've been there since Monday. I got an email that, was kind of icky and it wasn't our fault, but it was what it was. And my COO was like, we got to respond. We got to da, da, da. And I won't get too much into it because that wouldn't be appropriate. But basically I had to just sit with it. And, I talked to some trusted colleagues and I meditated and I kind of just like asked for an intuitive thought. And then I woke up this morning and got to the office early. And for whatever reason, I felt comfortable, starting to type that response and I wasn't reactionary. It wasn't emotional. It was just very, it was okay. And, but I had to sit in the discomfort for a while first. So anyway,
And you
Sandra,
come out better on the other side of that. It's painful, right? It's just that there's a certain process that you have to, go through internally to get to a point where you can actually tolerate that pain. I sounds horrible the way I'm saying it, but it is truly trying to tolerate and get through that pain.
yeah, and I think just you remind me too, like one of the biggest things for me is when there would be those instances, like not only would it be just uncomfortable, but I could find myself catastrophizing, where I'm like, writing the movie of what this is going to look like, right? Or I'm getting sucked up into that like fear of failure or the imposter syndrome. Like, so those are all things that I struggled with for a long time and had to do the work to put those to bed really in a big way. And I have, so it's still uncomfortable and it can still suck and I could still get upset even, but I've done the work to not get on the roller coaster where it's like the highs are so high and the lows are so low, which I think is a testament to, and I've mentioned this on the podcast before, like the significance of as a leader, personal, emotional developing almost nearly as important as classic professional development.
Yeah, I agree. And it's, one of the things that, people are very commonly ask themselves or have, as a question is what would I tell my younger self? And I think that, when you get into leadership, one of the things that I would tell myself is to make sure I understood that leadership is not defined by an organizational chart. It's defined by how you move through your life, your career. And I think that that's been one of the things, and I see it even with younger professionals. They want to move up, right? Well, moving up means, is org chart oriented. And I try to push, people to think, yes, that's a great aspiration, but think about what it means to be a leader. It's not about having people just report to you and being a decision maker. There's a difference between a leader and a manager. And if you're thinking more management, that's very different than leading. Leading means you're out there pushing, new ground. You're kind of hacking down the weeds so everybody else can kind of follow behind you and move into a different direction. And I think that's one of the biggest challenges for me has been trying to get out of that over years of just, it's not about the org chart. It's about my experience as a leader and trying to do things differently and experience different experiences, because that's what creates more well-rounded experience for us all, right? And I think that's been kind of a revelation over the last 8 to 10 years.
Yeah. Well, so I want to talk about that journey. And by the way, that's the last question that we ask on the podcast every episode. So you stole our thunder a little bit, but it's well said. Well said. So Sandra, talk to us a little bit about where you started out. So, you can go as far back as you'd like, but kind of how you got started in your career. Were you always in healthcare, and kind of how you got to the point that you're in your career today?
It's interesting. I always wanted to be a physician. Well, initially a veterinarian, and then, I moved from veterinarian to a doctor. And then, so I went to college. I actually went to college, Charleston and Medical University of South Carolina. I changed from being a med student or trying to go to med school to really just getting out and making money at a certain point, right? But in the healthcare sector. So I went into administration as a kind of a stand-in, for lack of a better analogy. But I think from there I went into healthcare administration, and as a result, really began to understand more of day-to-day operations, and actually started out within medical coding as a start point, and then I moved in medical records, and then from there got more into administration. I think one of the things that was kind of interesting is in the 90s was the whole re-engineering, where people wanted to reduce expenses out of the operations because DRGs were coming in and people were starting to figure out how do I make money? How do I cut costs? And as a result, started getting into redesigning processes as a result, healthcare processes. And that led to understanding that people really focused in on trying to cut their way to success instead of growing their way to success. And as a result, started working as a consultant to help healthcare systems. And I've always been in healthcare in some way, shape, or form. Help healthcare systems identify ways that they could grow their business and see that they didn't have to cut their way to success. They could actually grow volume and revenue as a way to really drive new opportunities. And as a result, started getting into developing business strategies for healthcare organizations, driving new revenue streams. And as a result, started creating new businesses and new products, and just kind of evolved from there. So I actually started, for those millennials that may not know so much about Kmart, I was actually started out in the Kmart pharmacy years ago, when Kmarts were still around, and actually ran the blue light for blue light specials, for those who know that as well, which was kind of the highlight of my early career in healthcare, is ran the blue light specials for the Christmas, what do you call them? The kits for fragrances and that kind of thing. So it was kind of interesting way to start. But that's actually how I started.
I love that. Yeah, that's so cool. And you mentioned the cutting your way to, profit, or I'm mincing the words, success, right? But yeah, that's Alistair talked to me about that. He's at Emory now, and he's doing that. He's like, you guys need to trust me. We're gonna invest. We're gonna grow. We're gonna and nowadays too. I think at the time, like you'd have to use a lot more strategy and a lot more kind of process type of work, like almost in a manual format. Now there's technologies that we can leverage to kind of achieve a lot more of that. So investing in the technologies, not in the shiny objects, but appropriately to help facilitate that growth. Yeah, no, it's super interesting. And I think really important still today, that we don't get caught up in just trying to cut our way to success.
Yeah, and I think, and I'll use the analogy, with everything going on at a federal level now, there's a lot of concern that people are just cutting, they're cutting budgets, if you will, at a national level that'll translate into local impacts, if you will. The difference is, what you can do is you've got to restructure, and we'll come back to what you mentioned about automating and leveraging tools. You've got to restructure the process, because otherwise, if you just cut, without changing how you deliver care and services for the future with less resources, you're not going to be able to sustain that. So cutting is not, it's an important aspect, but it really should be the goal of how do I reduce that expense, right? Versus how do I cut expenses? And I think that gets into the systemization of how do we deliver care and services. So automation, and a lot of people will use the words AI. I've tried to get into leveraging, and at least initially, automated aid as a way to kind of begin to think that way, because AI is that shiny object for a lot of people. But if you focus in on how do I automate certain processes, or how do I aid in diagnosing and treating sooner and better and at a better price point, how do I aid a physician in doing that? That's where you're going to get sustainable changes. And I think that's where, as an organization, we're beginning to kind of focus our efforts around those, because otherwise you're kind of painting that big picture of, we want to, we're going to leverage AI to do A, B, and C. Well, what does that mean? And you got to really dive down into the details just to really understand how you're going to do that in a way that you can sustain it, but you also understand how it works, which is a critical cultural challenge that you have to overcome as well with artificial intelligence. You've got, sorry to go on a tangent here, but you've got a lot of physicians and clinicians who need to understand how AI is working in the background, how it helps them make a better decision, how it aids them in what they're doing, and how they will use that information to either make a change in how they diagnose or treat patients. If it's just information for information's sake, and they're not necessarily seeing that that information is going to help them do a better job of diagnosing or treating, then it's probably not going to be something that those clinicians or practitioners are going to use in the future or feel comfortable using in the future. So helping kind of the staffing and the staff and the manpower to understand how to use those tools is going to be just as critical as the tools are themselves.
No, absolutely. Education is crucial. I think also when you focus on the specific use or use case for the technology, and it's less about the AI, not only can it become more clear to the folks that are either going to be using it or it's going to be affecting them in some way, but it's less scary. And you kind of said that in so many words. But and then the other thing is that, I mean, if folks don't even realize how many aspects of their life like AI is already integrated into, you know what I mean? But it's just because it's not like there's not an AI stamp on it, right? Moreover, there's other things that companies or even or internal personnel will start saying is AI when it's really mostly just automation. which is not necessarily AI. So there's a lot there, but I think as a rule, I think the less you can just throw around AI willy-nilly, the better. Uh, Sandra, so getting back to kind of your journey, if you could think about, and we've already kind of hit on some stuff, but what was one of the most important things that you learned along the course of your journey? And it could be something that is just a lesson that sticks out to you, or maybe a time that you had a project fail, but you ultimately took away a profound lesson, or just does something stick out in your mind at any point kind of in your trajectory that you might share with us today?
There's probably two things that come to mind. One is a lesson learned from one of my previous bosses, which was, Sandra, there's the most powerful sentence in the world, and it's also the shortest sentence in the world. And it is something that can be used, and that is simply no. And so learning to say no has been a real challenge for me, but it is truly powerful when you do it for a number of reasons, right? One is managing your own time and effort, but also managing the expectations of others sometimes is just as important. So we get a lot of companies that reach out to us because we make some early stage investments, but we're really focused in on strategically bringing in companies that we want to be able to evaluate how their technology can work for us in solving our problems. And also, how does that potentially position us to better understand how we have to position the network and our workflows for the future. And sometimes you love working with these companies, and you really want to work with them, but sometimes you have to say no because it's not the right fit. It doesn't solve the right problem for us. You know, saving that company that time versus trying to work with them is just as important. And so that's been a huge lesson. And I try to tell people that as well. They need to get to no's faster if they can. The other thing is I use this quite frequently is I like to use the F word, focus. It's not necessarily what immediately comes to mind, but I kind of mentioned it earlier about focusing down on the problem, but focus is really hard to achieve, but it truly is one of those things that has been extremely beneficial to really create skill sets around and really focus in on. It keeps you to task. And particularly in innovation, I'll say this, particularly in innovation where you got a lot of creative opportunities and you've got a lot of opportunities to try different things and experiment, focus is hard to maintain.
I'm dealing with a smaller hospital system, four hospitals, a few handfuls of clinics, and they have a gentleman who's very close to the CEO who has this vision for the future of their kind of concierge. It's just the focus is important. Yeah, I'll just leave it at that. And then what you were mentioning before about getting to know, I just want for all our listeners who are working for digital health companies and I think one of the things that I learned early on, like, not only is it good to get the no, right, because you're not spinning your wheels, and but what it made me think of too was when we were just starting out, we would there was a few opportunities where we would get the initial engagement signed, and we would get onboarded as a vendor, and we would start our work. And during the course of the assessment or the analysis, a certain stakeholder on the customer side might have an inclination or the way they wanted to do things that we didn't really feel like was totally right, but we were a young company and they were paying us, and it's like, okay, like, and we kind of just went along with it. I think part of that personally had to do with my people pleasing, which I've since rid myself of, which I think has to do, I feel comfortable saying no today too, which I think is tied to that. But in regard to this, I think it was some of that, and also some of the thing like, well, damn, we're an early company. Like, we need to, if I could do it over again, would I do it differently? I like to think I would have, but sometimes you just don't have that luxury. Now that we have that luxury, I'll tell you though, that we're very comfortable, like, tactfully speaking up. And like, what kind of trusted advisor would you be if you weren't, right? Like, you need to, find a way to do that in such a way that, you're not offending someone, but you're standing in your knowledge of, like, and experience, and hopefully being able to cite other specific examples of how that may have went awry, or how that was successful, but this is the way they had to approach it, or whatever. Now this is great, Sandra. I wanna talk about Hackensack. Before we get into it, I always just like to ask favorite book or literary piece or blog that you've either been reading currently, or it could be like an all-time favorite, your choice.
There's a book recently I finished that was called The Heat Will Kill You First. And I think it's Goodall that wrote it. And it's about how climate change, and particularly heat, are impacting health. And it's kind of like a silent killer in many respects, and the impact that that's having on so many different aspects of health, but also other aspects that actually have an impact on health, food security, and those kinds of things. So that's been kind of an interesting thing, is really trying to understand the ecosystem that impacts health in general. And then how does that translate into, as health providers, how do we position ourselves to better understand that and potentially anticipate some of the challenges associated with that? So that's kind of an interesting one. And I just started literally 5 pages in on Freedom by Snyder, just to understand, kind of freedom in different contexts, how that translates into different meanings around the world, and even how that impacts on health. So it'll be an interesting study kind of moving forward.
Yeah, I'll look forward to hearing about that one. I've heard of it. I haven't read it myself, and the climate issues and just sustainability concerns, even in general, and how they will undoubtedly affect healthcare in the not so distant future. It's staggering. I'm actually working on a passion project. It's like a company called Think, with a colleague of mine, and we're working on a platform that will automate an organization's evaluation of their alignment with UN sustainability goals, and then track their progress as they make improvements. I mean, there's been consultants doing work in that space for a long time, but I don't think there's any platforms that are really automating it well today. And with now the advancements in AI, I think there are more opportunities to do that. So we'll see. But something I'm really passionate about too, because it's, my daughters are 2 and 4. Like, these problems are going to be very real for them, and certainly for their children. It's anyway. So Hackensack Meridian. So how long have you been there now?
Well, I was with Meridian before Hackensack Meridian, so it's been about 20 years. So between the two.
That's awesome. So, Sandra, talk to us a little bit about your, vision for the organization based on kind of the overall mission that you guys are tracking towards, maybe in your world, and maybe some of the key initiatives that you're focused on.
So I think a couple of things that to mention one of the things that we really are driving towards is transformation. So, and it's aspirational, but it is really how do we transform what we do and how we do it to make a huge impact on outcomes, clinical outcomes in particular. And yes, there are operational aspects of that as well. So being operationally efficient, for example, and being able to do that. I think one of the things that we've done at a very high level is really pull together academics, research, and innovation. So we have a large academics program. We have medical school. We have a large GME program. We have a large research program as well. We actually have a translational center for discovery and innovation, which is really translating, taking very focused scientific efforts to solve clinical problems, particularly in immunology, oncology, infectious disease, multiple myeloma, a number of key areas that we're focused in on, and really bridging the gap between discovery and translating that into clinical practice. So how do we facilitate a much shorter, more efficient connection between discovery and changing what we do at the bedside? That's a major initiative for us. So, and infectious disease is a good example because those are areas of opportunity that really are preventable. So you've got prevention, but you've also got treatment as well. So understanding the dynamics of that throughout the state, because we do have 18 hospitals all over the state. So understanding that even where patients are coming from, nursing homes, communities, all have a very different impact on our ability to diagnose and treat very specific infections. You think about oncology, for example, and we have a very large, one of the largest in the country, bone marrow transplant patient populations. And these are patients who have extremely immune systems that have been extremely compromised because they have to be for the treatment options. And because of that, you get a lot of different kinds of risks for infection. So there's a lot of connection there. But anyway, having said that, I think one of the things is really focused in on trying to drive key problems and challenges and solutions from all the way from academics to the clinic. That's a major initiative for us. The other is really, I'll call it a little bit more pie in the sky in some respects, is really developing an innovative culture. And what does that mean within an organization? We have 37,000 team members, and that doesn't even include physicians that we have on board. I think one of the things for us is how do you develop that innovative culture and what does that mean to an organization? And for us, what that means is trying to have 37,000 problem solvers, right? People who are solving problems and challenges at the bedside on a day-to-day basis and understanding what that means and how to do that. That's what we see as an innovative culture. So we've been trying to drive more internal innovation challenges, bringing our staff members to the problems that we as an organization, as leaders in the organization, are trying to solve, and really kind of crowdsourcing opportunities for people to share their thoughts and ideas and potentially drive that change from their idea within the organization. So those are kind of the two major opportunities. And of course, as we do all that, one of the greatest opportunities for us is to how do we leverage that to not only change healthcare, but how do we commercialize some of those opportunities as well? So that's that commercial aspect of what we're trying to bring to bear as well, which takes a lot longer, obviously. But it creates some unique opportunities for us.
One of the things that I love what you guys are doing with kind of what I heard, like creating a culture of innovation within the organization. And I think it's so needed on so many different levels, at a more tactical level. Any of these new technologies that are exciting that we want to see implemented successfully at a health system really require a culture of innovation. I mean, in my experience, because one of the biggest enemies to innovation, and in particular, a culture of innovation, is fear, right? When my when my colleagues have been have came up in a culture such that they're afraid to make a mistake because, everything was always urgent, and, someone was saying, oh, we got to get it done. We got to get it done. And people's bonuses were tied towards not making mistakes. And like, it's all these things that historically a lot of health systems, not just any one in particular, have, propagated. There's things I have to do to unwind that. And until I do, because innovation, right, requires me to make these seemingly little decisions in the sequential order. Sometimes it fails, sometimes it's successful, but I integrate the feedback, I pivot, and I move forward. And that's how innovation happens. It becomes a machine, but if people are afraid to move, it creates this paralysis that, in innovation, it's hard to thrive. So it's I think to draw that out, it requires a leader all the way at the top who's really committed to that. And then it kind of goes down from there, and really, and if you don't have that leader, I've seen that, or worse yet, you have a leader that's in that kind of position that is still kind of in that old school mentality, you can poison the entire well. It's remarkable. So crowdsourcing ideas, and like I love that.
One of the things that's been extremely fun from this process is really been seeing the lights go on and the excitement of the leaders when they start to hear these ideas, and they get absolutely engaged and energized by the possibilities, right? And I think that's, when we've been able to achieve that to the point that they're asking for more, that's a great thing. But I love seeing some of our team members prepare. They are ready to promote their idea. They get that idea up there. They are hanging tight with challenges and questions that come from the leaders. And the leaders are absolutely amazed by how good and prepped they are. And part of that is part of the building the culture, right? You got to help them. You got to make sure that they're giving their best, and you're trying to help them. That's part of what we do from an innovation perspective. But what really I love is seeing them go, oh my God, what a simple or what a fantastic idea. And this is fantastic. And that is what you want. You want to unleash that, what's possible, right, within the network. And I think that's been really exciting to see the transition at a leadership level of saying, oh gosh, maybe we don't have to solve all these problems ourselves. After all, we can really tap into people differently. And that's really exciting.
Yeah. Three quick things because I don't want to try to forget them. Like, look at hackathons, like these companies, large companies that have hosted hackathons. Huge ideas have come from it. Like, for example, TalkDesk, Tiago, friend of mine, that company was born out of a hackathon years ago. Now it's $1 billion company. The nurses within an organization, like not all organizations have a CNIO. I've been shouting from the rooftops since I've had a media brand the importance of incorporating nurses' perspective into crafting, I say digital strategy because that's my world, but like just strategy in general. Who spends more time with the patient than the nurses? And if that voice isn't being heard, I'm missing the mark, right? So, but I love the idea of incorporating not just the nurse, but everybody, kind of that crowdsourcing. I think it's fantastic, from the administrators to everyone that touches the lives of these patients. Well,
you were bringing up the nurses. I think one of the things that we found is that many times nurses have workarounds when processes or things don't work for them. They create workarounds, and we say, look, workarounds are really the innovations of the future. And so we try and drive them to say, look, if you've got a workaround, then there's a challenge. The question is, Is that workaround scalable? Is it something we can, I call it packaging. Is it something that we could package and scale throughout the network that really just maybe it's only works within our network and doesn't work outside of it? That's totally fine. But I think it's interesting because those workarounds are very unique opportunities for innovation.
Yeah, 100%. This is great stuff, Sandra. So couple last questions I would have for you. One would be, what are some of the biggest challenges you guys are facing right now as an organization?
I think for us, I'll go back to the AI, is really where do we focus our efforts to really drive AI or automation within the clinical realm? The operational realm, I think, is a little bit easier, but it's the clinical realm that we are seeing that we got to really identify where we want to focus our efforts on. And so that's a big challenge because it's a big network. You got a lot of different clinical areas you can focus in on. So trying to narrow that down to an area that we feel comfortable to start be critical for us. And it's a big challenge. One of the areas that we're super excited about is ambient speech and using ambient speech to automate, but also to diagnose. We actually have a company that we've been working with that leverages voice biomarkers to diagnose different types of conditions and situations with patients. So, leveraging that technology, which is easy for patients to engage with, is really a unique opportunity for us. And if we can do it in a way that helps provide more information to a clinician, even better.
Wow. Yeah, I remember, I think we talked about a little bit about that when we first met, however long ago, that super cool. So one of the last questions I would say, Sandra, where do you see healthcare going in the future, with the acknowledgement that you don't have a crystal ball, but what do you think will be some of the biggest changes as time passes?
I think we've all kind of talked about it and visualize it, but I do think that more point of care or in-home testing is probably definitely an area that we're going to see come more and more available as sensors continue to get smaller, less expensive. Power sourcing of those are different. I think we're going to see a lot more push into the home. So I think we'll see some consumerization, if you will, of some of the basics. I think that's going to drive how we interact with patients very differently. It'll be much more personalized in some ways. And I think that's one of the biggest challenges as well. How do you really personalize interactions with patients for the future? I think that's where we as organizations have to begin to understand how we can really interact with patients as individuals, as ends of ones, and not, diagnoses, if you will. So I think that's going to be a huge challenge and a huge opportunity going forward.
Yeah. And my hope is that as that really flourishes, that we can tie that back to kind of the front end of, how am I using that same personalization, those same kind of, IoT devices or whatever it might be to take better care of, these humans prior to them being sick. Right. But doing so in such a way that me as a health system with these tight ass margins that I can actually afford to do it. Right. Or commercializing it in a way where it's not, it's both beneficial to the healthcare provider and the patient. And
we may have to change our business model in what we do. And that's what usually happens as different industries evolve. The business model changes. We're just not really as agile at making those changes sometimes as other industries. But I think we're going to see an explosion in that in the next 10 to 15 years.
Yeah. And I mean, with the insurance side and with the government side and with you can't be, unfortunately, in the United States. It's just impossible to be. But I agree, and I'm hopeful. We do like to end, Sandra, on the piece of advice you would give your younger self. So just to reiterate, you had said in the beginning.
Yes, I think one of the biggest issues is really understanding that leadership isn't an org chart. It's a journey. It's always important to strive in your career to do things, not to find your spot on the org chart.
Love it. Sandra, thank you so much for joining us today.
Thank you. It's been a pleasure.
And to our listeners, thank you all for tuning in. We will catch you all next week.